I'm delighted to share study results which were recently published in the British Journal of Cancer. I am Emerens Wensink, a PhD candidate at the University Medical Center in Utrecht, the Netherlands, and I'm currently under the supervision of Janine Roodhart, medical oncologist, Miriam Koopman, professor and medical oncologist, and Onno Kranenburg, professor of translational oncology. Our study is a collaboration with several oncology centers across the Netherlands and also with the Netherlands Cancer Registry. A subtype of colorectal cancer patients have a deficient mismatch repair system. This means that these patients accumulate mutations in the microsatellite regions of their genome. These patients, especially when they have metastatic colorectal cancer, have a worse prognosis compared to patients with a proficient mismatch repair tumor. Fortunately, recent studies have shown that these patients benefit with a long-lasting response to receiving immune checkpoint inhibitors. Initially, the data was based on single-arm studies, which meant that the European Medicines Agency did not grant approval for the use of immune checkpoint inhibitors until the recent publication of the Keynote 177 study, which did include a control arm. Based on the initial studies, which were single-arm studies, it was hard to interpret the data because only 5% of patients with metastatic colorectal cancer have a deficient mismatch tumor. And so there were very few studies which showed what the survival was of these patients while receiving chemotherapy and targeted treatment without immunotherapy. We wished to report the survival of patients with metastatic colorectal cancer and deficient mismatch repair tumor while receiving systemic therapy without immunotherapy in order to better interpret the results of the immunotherapy studies. In our studies, we examined the survival of patients with metastatic colorectal cancer and deficient mismatch repair tumor while receiving chemotherapy and targeted treatment. Specifically, we aim to examine the